of tests globally. Okay. Brazil comes second with over 1.1 million cases. The deaths 52,788. Russia comes 606,881 cases. They have the total deaths in Russia is 8,513. India follows with 465,000 cases. UK follows with 306,000. Spain 293,000. Chile, Italy, Iran, Germany follow in that order. And then I'll give you the African figures. That's according to the African Centers for Disease and Control. The African figures currently, June 24, is 324,696. The deaths for Africa is now 8,618. And the recoveries for the continent is 154,170. And then still, Southern Africa leads the pack. It has 110,000 cases, 756. The deaths 2,160, and recoveries 57,231. Northern Africa follows with 85,343 cases. The deaths 3,618, and the recoveries 34,467. West Africa, where Ghana lies, has 64,957 cases. The deaths 1,180, and recoveries 34,763. Eastern Africa follows with 32,644 cases. The deaths 980, recoveries 14,416. And Central Africa is last on the list. It has 30,996 cases, 680 deaths, and 13,293 recoveries. So still, Africa's numbers are not rising that fast. We have not really seen much of the numbers yet. It could be for good reasons, it could be for bad reasons, and all that.
Could it be because the different blocks are not testing as much as...
Well, I mean, the Africa conversation has largely been around the testing, because the testing has not been as aggressive. Because if you look at a country like Nigeria, the most populous nation with over 200 million people, the last time I checked their tests, they were just a little over 200,000. And it's quite worrying. So far, the highest test is South Africa, and they have tested, and also they have the highest number of cases anyway. They have tested about South Africa's case count currently is 106,108. They've recorded 2,102 deaths. 55,045 people have recovered in South Africa, and they've tested 1,382,772. So they have the highest test so far on the continent. And also there are fears that there are suggestions some of the African countries may be hiding a lot of their figures in terms of the deaths that are being recorded. I mean, you can just let sometimes the death pass as normal deaths and not necessarily link it to COVID, because you don't want to really go and investigate so much and then put yourself on the radar. So,
but how does that also contribute to creating an illusion that we are on top of things?
Yeah, it does. We know the Tanzanian situation when the Magufuli came to declare that they have won, they have won the victory, the battle over COVID. Meanwhile, we know that before he said that for nearly a month, Tanzania was not giving any information on their coronavirus management. So how do you suddenly come and tell us whatever? And the same situation happened in Burundi, and we saw the mess. The strong man, in quotes, Nkurunziza painfully died, and we were told that it was a heart attack, but the information that trickled in later says that it's a COVID condition. And so if you deny it, it will definitely come at you. You can't hide it. So we pray that we don't just pay the price for trying to be in denial for what is happening. So also let me look at some of the figures from across West Africa. Nigeria currently has 21,371 cases. Their deaths 533. Their recoveries 7,338. And the test they've done so far is actually not 200. They've not even crossed there. Nigeria has tested 117,569. And Ghana, we are almost more than 270,000 tests, I think. So far, we are among the highest in terms of tests after South Africa and Egypt and the rest. Yeah, so those are some of the figures across the continent. Let's also look at some of the Africans' headlines coming from across the world. So Zambia's hot, not exactly so. In fact, it appears that even if you check globally, the news our COVID is dwindling a bit. Because sometimes when you go to the likes of the BBC, now you could see that news that are coming are not much of COVID-related news.
Does that mean we're getting used
globally itself, COVID? A lot of other things are changing. So we are now, if you look at our news now, in as much as you hear COVID, a lot of other news is also happening, and that tells you that in as much as the disease is not gone and it's still causing havoc, the world is deciding to move on. And so,
but what does this mean for us as far as our ability to, get rid of the disease finally? I mean, it's a pandemic. We don't know when it's going to leave. But if we already have this fatigue, what does that mean for the rest of the year? Dziffa, it's a danger. It's a danger for everybody globally. And like I've always said, that it's a risk taking now for everybody. I mean, not long ago, Germany was being praised for its handling of the pandemic. Yeah. Just yesterday, we heard that they have to lock down some states because of a spike in cases. So, and I've always said, there's no template for anybody to follow. Yeah. There's no perfect template. It's a completely new situation everybody is dealing with. And so a lot of the time, everything we are doing is a risk. Yeah. So you are only hoping that this risk I'm taking, the consequences may not be as severe. And that can be your only hope, like what Ghana has done currently with the new protocol for discharging. It's a scary situation, but we can only hope that the consequences, if there are, will not be severe. That can be our only hope. So that's basically what the world has to deal with, because this could be here for 2 years. Yeah. Because if you check the pandemics that came, the 1918 pandemic flu, which was one of the pandemic, that flu pandemic, it took about 18 years. If you check swine flu between 2013, 2016, thereabout, it took about 2 years. It's only a few of them that lasted about a year. So we can only hope that as long as it's here, we want to live and live cautiously. I think that's all. Okay, so I'll come back to you to figure out what's going on in Liberia. Their Deputy Minister of Education is in Ghana treating for COVID-19. But Sixtus, give us an idea on what's going on in Ghana.
Dziffa, as we speak now, the Ghana Health Service is reporting that our confirmed cases, the total count is 14,568. A breakdown of that will give us 95 deaths with 10,907 recoveries, stroke discharge. Yesterday, or I think the day before, there was a concern as to which from this figure would you say have fully recovered. Still breaking down that 14,000 figure, we are seeing that our active case count stands at 3,566 with 414 new cases being recorded. And we can look at the regional breakdown, starting from the Greater Accra, which has the highest case count, standing at 8,407. The Ashanti region comes next with 2,868. The Western region, 1,148. Central region, 794. Eastern region, 400 cases. The Volta region, 314. Upper East region, 271. Oti region, 105. Western North region, 82. The Northern region has 61 cases, and the Savannah region has 37 cases. From the Savannah region, we see that the Upper West region follows closely with 35 cases, still maintains the difference 2 case count that we saw the last time, with the Bono East region also following with 33 cases, also a difference of 2. The Ahafo region has 8 cases, and Northeast region has 3 cases. Further to this, we can also look at in terms of the general surveillance enhanced.
Yes, before we get there, what do we make of these numbers, though, in these different regions?
We see that the Bono East and Ahafo regions previously, these had low counts. In fact, Bono and Bono East had just 1 cases each. It was the Ahafo area that was, I think, 3 or so. But we see that this is increased. In fact, Bono East has moved up the Ahafo region has also moved up, and Bono region still has 3 cases. So it calls for worry that the places we otherwise thought were safe zones may not be safe after all, or something is going wrong there, which may need attention. But I realize that the Greater Accra region, the Ashanti region, and the Western region still has scary situations.
Did we do enough in the Ashanti region and the Western region to ensure that the numbers won't get to where it is now? And what do you think we could do in the other regions to ensure that they don't get to where the Ashanti region and the Western region is right now? I'm not even going to look at the Greater Accra region because the gap between the Greater Accra region and every other region is so wide.
The Ashanti region started receiving some sort of attention from central government on this management relating to testing, supervision, facility, and all of that. Irrespective or notwithstanding the attention that the region was getting, we still are seeing the cases rising. So we may want to go beyond that attention to, for instance, like I keep saying, to find out how Bono region is handling it. Because so far, Bono region remains the best model as far as we can see from the statistics that we have here.
But do we also know the number of tests they've done, for instance? Because when you were listening to Eben, it seems as though there's a correlation between the number of tests you conduct
and the cases
cases you record.
Yes, but even going beyond the number of tests, we know that as a country, we have a policy, an approach to testing, which hasn't varied from one region to the other. So even going beyond the testing, there's still something else that the local authorities are doing, which we are not doing in Accra. There's something that the management of the various markets or places that usually would have a lot of people congregating are doing that we may not be doing in Ashanti, in Western, and in the Greater Accra region. Look at the Western region again. You realize that the Western region also has a cosmopolitan outlook. We have people of all backgrounds working within the area. And the cases that we are recording lately, you see that they are also coming from some of the sectors. So it may have to go beyond the question of testing. Whether we are aggressively pursuing the testing is one thing, but also whether the various protocols are being implemented at those levels and how effectively the implementation is happening.
Okay, but do we have an idea of how they are, complying by the protocols in these regions?
So that's the point I'm making, that the Bono region, for instance, you may see that there are some conscious efforts to implement or at least supervise the implementation. Whether we can argue that the people are naturally compliant is a different matter, but we see that there's some effort from the local authority to ensure that people are doing the things that they are supposed to be doing, which we may not be seeing from the Greater Accra region, for instance, or the Ashanti region, or from Western region.
Okay. But back to the Ashanti region again, we know that a couple of weeks ago we heard a story of an inmate who went to the Confederation Teaching Hospital without COVID, went for a different thing, and while he was there, he caught the virus. Have we learned anything from this experience to ensure that our treatment centers, our isolation centers are well resourced so that if someone goes in without COVID, they don't come out testing positive?
Following that story, the inmate was from the Kumasi Central Prison.
Yeah.
And following that story, I said on this show that the hospitals would also then have to begin to relook at their isolation policies, such that you don't have people interacting as they used to interact at the various hospitals. A lot of facilities across the country complained about the hand washing protocol, for instance, how it was difficult for people, for the hospitals to implement this. Maybe it goes to speak to the question of cost, that the hospitals simply are unable to sustain the cost involved in providing water soap and tissue paper for people to be able to wash their hands before they get into the hospital and after they step out of the hospital. Or the hospitals are providing, but the people are simply ignoring to do this. You go to some public institutions and you see that even though the institution may have made provision for people to wash their hands, clean their hands, or even wash and sanitize at the same time, as I observe in, say, the courts, for instance. In some public institutions, the thing is lying there and people are filing in because there's no one there to ensure that the people who are getting into the building actually wash their hands or sanitize or even both.
Thank you very much, sisters. Give us an idea of where these numbers are coming from, contact tracing, general surveillance, among others.
For the general surveillance, we have a recorded case of 6,019, and from enhanced contact tracing, we have 8,549. Recovered or discharged, I have already mentioned the figure, 10,907. We still have the severe cases standing at 24, and the critical cases standing at 6.
Okay. Thank you. Eben, we know that the Deputy Minister of Education in Liberia is currently in Ghana treating for coronavirus. What exactly is going on in Liberia before we even take a look at what he's doing in the country?
Well, I do not know the details much, but from what I read, it appears he has a heart condition. And Korle Bu has one of the best heart treatment facilities. The National Cardiothoracic Center is at Korle Bu. And I'm told that from somebody, an official from Liberia, spoke to us and he said that the dialysis system in Liberia has some issues. So it's the reason he came here. So I'm not sure it was purely based on the COVID, but the fact that he probably has an underlying heart condition, and Ghana has a place at Korle Bu that can treat this well. The dialysis is a critical place. If you are not getting it, you have that condition, you die anytime soon. So I'm sure that's probably the reason he's here. So I think that on that basis, I don't necessarily think it had to do with the fact that maybe we had the best COVID treatment centers, and that's why he came. I mean,
Liberia
everybody said, and it's Liberia anyway. It's Liberia. We know that this is one of the poorest countries in the world currently. They have struggled to build their systems and all that. So of course, so they've gone through Ebola, which killed almost 5,000 people in that country within 2013 and 2014 thereabouts. So of course, if they have a challenge and the people can afford and they are in a certain condition, they will definitely come to Ghana. They have some of their nationals already living here. So, but it just tells you that the disease, as we have said, is no respecter of persons, and it's just hitting across. Because in Ghana, we are even told today, per our own checks, Citi News, we confirmed that the CEO of Korle Bu Teaching Hospital has actually contracted COVID-19, and for about 10 days he hadn't been to the facility. The news didn't come from him; he didn't tell us, but we got the information, and we can say that unlike interestingly, you have the people leading the health spaces. We know the CEO of National Health Insurance tested positive. We know our health minister tested positive. We've even heard stories about our education minister who has taken a test because he's unwell and he's waiting for results. But we are told that he's at UGMC already, and we know what UGMC is. It's a COVID-19 treatment center.
We have a report on
we are hoping
Deputy Education Minister of Liberia. So we'll take a look at that and continue the conversation.
Well, the Deputy Minister of Education of Liberia, Mr. Lakin Dapton, has been flown to Accra Korle Bu Hospital for complications that he suffered that were exacerbated by COVID-19. So it is not per se that he's there for COVID-19 treatment, but he has had pre-existing conditions that our hospital here could not handle. So he was referred to Korle Bu Hospital, and he is in Accra right now as we speak.
There are so many African countries. Why is it that Ghana is the one you decided to get him into for treatment for his complications?
The referral was made by his doctor, and it was determined that Korle Bu will provide the best treatment. So this is where he was referred to. And as a government, we engage our counterparts in Ghana, and they, under special conditions, allow him to be flown into Accra, and he's currently now at Korle Bu.
So there you have it, the reason why the Deputy Education Minister in Liberia is in Ghana treating for coronavirus. Now, Sisters, we know that the very early days of the pandemic, we used to, refer to people from Burkina Faso, Guinea as foreigners in a country, trying to deport them back to wherever they came from so they can get treated where they are originally from. And people are asking questions, what happened to our unity as Africans? Now that we have a pandemic, it looked like everyone was focusing on their own country. What does this mean now that we are bringing in other leaders from other countries on the continent?
Certainly a plus for Ghana.
Or they are bringing themselves. It's not like
yes, certainly a plus for Ghana. You see, we must understand that at the initial stages when COVID-19 started as a world concern, world leaders were primarily concerned with safeguarding their immediate responsibilities, areas of interest. So the Ghana president would have been more interested in protecting Ghanaians from the virus than protecting Africans, because each country has a president whose responsibility is to protect that particular country. And so the initial response was to stop all movements because of the nature of transmission of the virus at the time. We were scared that if we allowed people into our countries, through that we could, record and escalate the cases. But now we have it, and we have moved past that prevention stage. We are now in a management stage, you see. And so the fact that Ghana has been identified or recognized as a country that other people can come to for help, I think it's a plus for us. At least it speaks to our role, our should I say, our responsibility in this whole concept of African unity and what we are supposed to do as a nation to ensure that Africans all over or all across the continent are protected. Mm-hmm. You'd recall that the same Liberia in the days of Ebola, mm-hmm. This is where we had the center, the center for Ebola. It didn't come at a small price to the government of the day at the time. Mm-hmm. But there was a conscious effort to set Ghana as a safe haven to be able to study the disease at the time from here and to offer some treatment solutions to people. And so there was the center set up here. And that again shows the leadership role that we as a country have to take, or assume at least, in crisis times such as this. Yes, he may not have come into Ghana simply because of COVID-19, but to use other facilities, as Eben is saying, or even as the information minister has just told us. But it also tells us that we have a certain system which is working, mm-hmm. and which we must safeguard. We cannot allow that system to break down. So because we now know that the rest of Africa is looking up to us, we should be able to go beyond where we are now, put in place a lot more structures, reliable structures, so that we are not just looking at ourselves, but we are looking at other Africans who may need our help. Mm-hmm. So that also that we don't tend to give priority to other big men from other places when they are flown in. Mm-hmm. I cannot say for sure the kind of treatment the minister is receiving in Ghana. I don't know what arrangements have been made for him, so I don't want to speculate on that. Yeah. But I don't also want to believe that he's been prioritized over other cases that are of Ghanaian nature.
Well, initially we had a VIP clinic, so if we have stuff like that, there's be a possibility.
You see, so that's the point I'm coming to, that mm-hmm. we don't need to have VIP clinics. We need to be able to set up the system in such a way that the ordinary Ghanaian can receive the treatment that is deserving of him. Mm-hmm. At the same time, we will still have something for the other African nationals who may depend on us for the same services?
Okay, Eben.
Yeah, so my check showed that according to the African Centers for the CDC, as of June 24, Liberia's case count for corona is 652 cases, not even up to 1,000.
Okay.
The deaths, they've recorded 34 deaths. They have 270 recoveries, and they've tested as low as 3,013. 3,813, not even up to 10,000. But I'm also told that there's a certain trauma from Ebola, and people are seeing this as Ebola. There's stigmatization because they've equated it to Ebola, and because of that experience, some even don't want to test at all. So probably you can understand why their situation is like this. They've also closed their borders. They've taken some decisions. People are working from home still. I'm told that a lot of the health facilities have closed down, and a few ones are up and working. So possibly it could be the reason why this man has to come to Kolebu to get that kind of treatment, because at this point many of the hospitals who want to be dealing with COVID-related stuff. So when you have other conditions, they may not even pay too much attention to you. So that's the situation in Liberia. They are not having things easy. I mean, this is for a population of about 5 million. If not for the past history they've suffered, it should be a country that should be able to do a lot, build the country and serve the citizenry, because the population is not as scary.
What lessons can other African countries learn from this coronavirus experience? I mean, in Ghana, we've realized that we can produce ourselves. For a very long time, we've been talking about, freeing ourselves from foreign imports. We never actually made it happen until we needed to produce our own face mask. So we've had some positive lessons from coronavirus, but what can other African countries learn from this experience? Because it's getting boring positioning Ghana as the good kid in a bad neighborhood. Because us here don't really see anything so impressive about Ghana's health care system.
Dziffa, let me start from the broader African leadership, what we may want to call the African Union, for the purposes of this discussion. For so long a time, a lot of questions have come up regarding the real role of the African Union structure in some of these pandemics like this. When wars break up in Africa, the question comes up, has the African Union any structures to deal with the war, or deal with a peace negotiation, or things like that? If it's a health concern, the question again comes up, has the African Union any structures at all to look at the African continent as it is, different from other continents, different from other environments, to say that this is how this problem can be treated as an African solution? Do we have that within the African Union structure, or the African Union continues to remain that body that goes to heads of states go to meet and talk about bilateral cooperation, disperse, and we don't seem to see anything changing? That can trickle down to the sub-regional blocks. We can look at ECOWAS. How effective, or what really even is the role of ECOWAS in ensuring that, for instance, there's a real meaning of the freedom of movement of goods and services within the sub-region? But
beyond ECOWAS and African Union, the individual countries themselves, what lessons should they take from this to ensure that their health care system is robust, their manufacturing sector is not dependent on imports from abroad, that they can independently develop without, relying on foreign aid? Because one thing we've learned from this entire pandemic experience is when it gets to tough times, every country will look inward and they won't come to your rescue.
Dziffa, the easy and simple answer would be to say each country should build its own systems. But how do they do that? Some of the countries don't even have the means. To be fair to them, there's serious poverty in a lot of the countries, that the systems are simply not working, even if they are there. And even where the systems exist, corruption does not allow those systems to work or to effectively function. But you see, if we look beyond the individual country systems and put it together as a collective, the role that the World Health Organization is playing in this, for instance, if we had a body within the African Union structure or ECOWAS structure that could effectively take charge of this, work out solutions for individual countries to then pick up, it would have been helpful.
Okay.
So that whether you are a poor country or a rich country, you still have the mother union helping you, at least with the solutions on paper, so that it would then be left to you to just adopt into your country and find a solution for yourself.
But the organizations are actually doing some things. You know, the ECOWAS has what they call the West African Health Organization, which is WAHO. And they've been meeting, they've been engaging health ministers from the continent. African finance health ministers have been meeting. Furiata has been part of these meetings. They are finding ways for Africa to get
all the ministers.
Yeah, so a lot is going on. You may not hear it as much because recently, for instance, the African Union and the Africa Centers for Disease Control and Prevention, which is they give the updates on the African situation. They launched a public-private partnership with a group known as the Afro Champions Initiative. And this is a COVID-19 response fund. And the partnership aims to raise an initial amount of $150 million for immediate needs to prevent transmission and up to $400 million to support sustainable medical response to COVID by pooling resources and the medical supplies required. So there are a lot of things going on behind the scene. The African Union, the ECOWAS, they are working behind the scene. But at this point, a lot of the things is that in as much as you fight as a bloc, there are things individual countries will have to do by themselves. Because almost all the individual countries in Africa have gone to IMF for the emergency credit facility. Nigeria has gone for it. South Africa has gone for some. Ghana has gone for some. So in as much as you are coming as a bloc, individual countries will definitely still have to do certain things. And for me, I have said that if there's anything that's teaching us, if there's anything COVID will teach us, it will teach us that we can't run this country or any other country within the continent as business as usual, because your health systems will have to be solid, because you don't know the next pandemic that will come, and these outbreaks will keep coming. I mean, some have come in the past that didn't hit us much, because the H1N1 influenza, it didn't come here. The SARS, the one that came, it didn't come here. The MERS, which was mainly within Middle East, didn't come to Ghana. For me as a young person, I think my first time I'm experiencing a pandemic is this one.
Yeah.
I don't know what the experience was like when in 1918, that pandemic, because that pandemic, I'm told, it affected about 500 million people in the world. And by then it was about 1/3 of the world's population. And the deaths, we are told, is in the range of 50 million people. So imagine at that time, I don't know what the world was like when they were fighting that pandemic. This is the first one we are seeing. It's an opportunity to build up and get ready for anything that will come again. And I'm happy that we are doing a bit of infrastructure here and there. The private sector fund that is building the infectious disease center, an amazing facility. Very soon they will be done. A lot of things. Hopefully we will not go to sleep, especially because we have election before us. And sometimes these things can let you sway, and before you know, we've gone back to square one. So we just hope that we'll pick serious lessons from this and build our country the way we need to build and benefit from it at every point, and trade and what have you.
Thank you very much. Now, again, it's an interactive show, so wherever you're watching us from, let us hear your thoughts. The WhatsApp line is 0550585832. If you're outside Ghana, the country code is +233. This is the special coverage of the coronavirus pandemic. We'll go to the Accra Technical University now. Yesterday, they released a message to the student body and the community about a national service personnel testing positive for the virus, and the way the message was handled, Eben and Sixtus, they mentioned, you know, what the person had, how they are handling it, how they are going to disinfect the school, reminded the student body to always stay safe. Let's compare that to, you know, finding out that the Minister of Health, Akua Ametam, you know, testing positive for coronavirus, the National Health Insurance Board testing positive, and now the Kolebu CEO testing positive. What lessons can we learn from the way Accra Technical University handled this pandemic?
I think, I mean, the point is that you are dealing with a school population, and it's a huge population. And so if somebody tests, you can't keep it a secret. It's a bigger risk. So for me, as for the schools, it was no surprise that immediately they have to come out and talk about it. By doing that, it makes people in the school themselves take the precautionary measures seriously. Because if you came before and you thought nobody had it in the school, now somebody has it. So naturally you want to set up. You know, so for them, it is just what they had to do. And also don't forget that before the reopening of the school, these measures were in place. And there's a reason why we said some of the schools were even going to have spaces designed as isolation center. We know the PPE that the government provided and all that. So we cannot safely say that the government was opening the schools being aware that we could have cases when we open. That's the reality. It's the same thing with the church.
But also, let's compare that to what's going on in the health sector, where the people at the forefront will test positive, and then, you know, somebody will whisper it here and there, media house, they were confirming it, you know, as opposed to just coming out and saying, this is what's going on, these are the things we've done to ensure that our staff, you know, they're safe and the entire country can take this cue from us.
What it is that I've always said that African governments are quite opaque in their dealings.
Okay.
We are not very transparent people. That somehow connects to the corruption we talk about in Africa.
But we are also part of the government, and the school system is part of the government.
Of course. And like we said, in their case, when you have a bigger population and one person has it, you don't want to put them at that kind of risk. But don't forget, that is a public space.
Okay.
The minister is an individual person. But also, I link it to transparency and how opaque we are when it comes to the way we run government. And that's why you're experiencing this. But you see, what people forget is that leadership comes with assets and liabilities.
Okay.
Now, when you're a leader in such a situation, the liability is that because you're a leader, you have to tell us that you have COVID. And it brings up a certain awareness and also has a way of dealing with the stigmatization we talk about. But as a private person, you could decide not to. But as a minister and as a public officer, it is important that you see that the role given to you gives you that responsibility to do that. Otherwise, ordinarily, there's something called patient confidentiality in medicine. And it hasn't changed because there's COVID. It hasn't changed. So the point is that it is because of this situation and the nature of the situation. And because this is an infectious disease, and that is why that protocol regarding patient confidentiality is changing a bit. But people still have the right necessarily not to tell us if they have COVID. But then it's a moral responsibility because of what we face. And also, and so in that situation, that there's not much you can do. But I thought that when you take that step, it's a plus for you. When you don't take it, we cannot really hold you so much. But just take it and then put people around you at ease, and also let the citizenry have a belief in the system. Because it has a way of making people believe that, okay, because there are still people who still think that once they haven't seen sick people on TV dying, they don't believe there's COVID. I'm telling you.
Let's hope that Alban Bagbin does not share in that. But Sixtus, we started this week off feeling very confident that we are somehow ahead of the fight. You know, a lot of people had now recovered thanks to the World Health Organization's new protocol of discharging patients. Midweek, we are finding out that the CEO of Kolebu has tested positive for a while now, actually, Dr. Daniel Asare. And the man who's so famous for saying that the virus does not move unless you move has now been, you know, he's there trying to figure out what's going on. He doesn't know if he's positive or not. But, you know, and even the way it's being handled, you know, us not being able to hear directly from him. He's a medical doctor himself. If you're wondering who I'm talking about, Education Minister, Dr. Matthew Poku Prempeh. What does this say about the fears we have of the virus and the stigma that we've been preaching people should stop?
Dziffa, let me start off by commending the Minister for Education. You know, his office has issued a statement explaining that he's been taken ill for some time. They've run some tests. The test so far is negative. I think there's a second test that is
they are waiting
the result for the second test. And that's all.
But before his press, people had already started spreading the message that we think this is happening.
Yes. As as a citizen, this is all I needed to know.
Okay.
You see,
and that's what you're looking at. That's a press release from the ministry.
You are my leader. This is a man responsible for a huge sector, our education sector. Mind you, schools have resumed for final year students. The tertiary institutions, we have also those final year students also already in school. Complicated by the virus that we have now. This is a man who is supposed to be actively monitoring.
So let me read what it says there. Our viewers have it there. It says the Minister for Education, Honorable Dr. Matthew Poku Prempeh, announces that he is currently detained at the University of Ghana Medical Center, UGMC in Accra. On Tuesday, 16th June 2020, he underwent various tests, including COVID-19, after feeling unwell for a couple of days. He tested negative for the virus, and this informed his decision to travel to his constituency for his acclimation on Saturday, 20th June 2020. Following his return to Accra, he still felt unwell and decided to check himself in for further tests, including a second test for COVID-19. Although the results are not out, he has been detained at the UGMC as a precautionary measure for further observation due to his condition. So this is coming from Rodney Nkoma Boateng, the press secretary to the minister. And I don't know when you saw this, but I saw this after several, speculations on social media.
Yes. So that's why I was making the point that this is somebody you expected to, or you expect to know his status, because he's going to be interacting with a lot of people. And when he's moving, he doesn't move alone. So yes, it might not be the question or the issue of patient confidentiality may still exist, but there are some of the public officials that would say that at least for the sake of the respect that you have for the people you are leading, and knowing that you'll be interacting with a lot of the people who may unknowingly mingle with you or interact with you in a certain manner that may predispose them to the virus. Let me announce to the people that, unfortunately for me, my fight or my leadership in our common fight against the virus, through that, I have also contracted the virus and I'm taking a back seat. I always use the example of the UK in this. Recall when the Boris Johnson's advisor violated the lockdown, a lockdown protocol that, well, you would say that this was the man who advised the Prime Minister to initiate this, and he himself, some way, somehow, found himself somewhere else. It became a whole issue. Not because there was any legal bound on him to do one thing or the other, but because there was a certain responsibility on him as the leader to ensure that the caution to the people is not just in text, but also seen through his own actions. And that is all we expect of our leaders. Accra Technical University, they've handled it well. They've announced to the people, they've cautioned the students, and they have told the students that we are taking care of the situation. There's no need to panic. And this is all we want to hear. That if I have a ward at Accra Technical University, I know that the university management is in full control of the situation. If they are unable, they will come back and tell me again, so I take a decision. It's just so that citizens are able to rely on the judgment calls of the people who lead them. So the Kolebu CEO, imagine the facility. If he had not isolated himself, even though
let's continue.
And he kept on going to the office, interacting with people who would not also have known his status, then imagine the ripple effect that would have had on the case count. So this whole virus, the spread of it depends on our interaction. We have all understood this. So where a public officer, a key public officer for that matter, contracts the virus, for nothing at all, it will only serve as a good model for this person to come out and say that I have it, pray with me so that I recover, but the fight goes on. So I think that really we need to change our approach to how we disclose some of these things to the public.
Okay, now Honorable Daniel Butcher has also come out to release a statement that he, he's currently on admission at the University of Ghana Medical Center upon feeling unwell. He's also testing for several things, including COVID-19, and he's awaiting his results. Eben, I mean, let's talk about the fears we have. Even us, people in the media space, Ghanaians on social media, it seems as though now all you need to do is walk in front of UGMC and someone will release a story about you being positive. Do you get me? How does that also feed into the fears people have about even finding out their status? A few weeks ago in Parliament, we heard stories of parliamentarians walking about because they're afraid that perhaps if they stay home, someone will start tracking them that, okay, this person has not shown up for 4 days, he's probably positive. At what point do we stop speculating and just let people be and get rid of that stigma that we've attached with someone is at UGMC, they must be positive?
You see, in the absence of information flow, speculation is inevitable. And that's the thing. I mean, and you see, the media is always looking for news. And you see, what people don't know is that these days, I have said it, currently, because of technology and because of social media, information travels faster than you think. And so this thing of, if the thing is there and you have to say it, say it. Because, for instance, this Dangote statement I'm seeing, I only read the story on my journal online before I came on air, that whilst we were reporting about the education minister, apparently Dangote too is at UGMC. And you see, I can tell you that probably but for the report coming out in the media, he will release this statement. So the point is that it has happened to others, and we have said that let's pick lessons from this as leaders and lead by example. So immediately, imagine that when these men went to UGMC, the rumor never came out, and they themselves, immediately they got the issue statement and said that, oh, we suspect we may have COVID, so we are taking tests at UGMC. We'll clap for you. And I thought that that's because that has happened and others have been criticized, even the health minister. The health minister's story should have even taught them some lessons. To say that the way the health minister handled the thing until it came in the media, before now the president came to confirm. The day the president was confirming wasn't the day he got the COVID. He had gotten it earlier. So if the government wanted to be truthful about it, they would have told us.
I think we should commend the CEO of Nyaho Clinic as well, because he really handled it.
And he is even a private, he didn't owe us that. He's a private man who runs his business. He didn't owe us that. At least the NHI boss took some lessons from that, and he came to announce.
But as a general public, are we empathetic enough with our leaders for them to feel as though if I come out and tell Ghanaians what I'm going through, they will embrace me? Because remember, when the health minister's status was revealed by the president, people automatically started sharing pictures on social media of the last person they saw him with and asking contact tracers to hunt those people down. I mean, the way we handle these information as well as a people could deter our leaders from disclosing their status.
No, but in fact, I think there was really nothing wrong about that. I mean,
about people calling out the last person they saw with the health minister.
There's nothing wrong about that. I mean, the point is that we had examples to follow, and the examples have started coming from other countries where people who mattered in society, public figures, celebrities, started speaking about their status. I was telling somebody that COVID-19 has a certain level of flex, because I don't know what kind of disease that you get and you have to come out and announce it. But it is because this is new and it's spread so fast. The transmission is so fast. And so that is why that culture of declaring your status started coming. And once you saw it, you didn't need to. I mean, the point is that we have said that COVID-19 is not a death warrant, because it's a disease that when you get it and it is detected early, we know up to now, the fatality rate for COVID-19 is still not even up to 10%.
Yes, but we are
so
also...
my point is that once you know that and you know that you can recover, as we see today, we know people who have recovered.
Yes,
and we have not stigmatized
we
against
are in a country where, in other parts of the world, when someone has recovered, people embrace them back into the society. The story of Frederick Dra, the man who shared his status with Umar Osanda in the very early days. We were expecting Ghanaians to welcome him with open arms. Look at the things his family went through. So the reality on the ground is different. And how does that also contribute to deterring people from disclosing their status? And what responsibility should we play on our leaders to lead by example so that the regular Ghanaian will also feel bold enough to say, I'm positive and I'm dealing with it? Sisters.
Dziffa, I have said in answer to this same question, I've already said on this show that, look, the reason we speculate is that we are not allowed access to the information that we need. You think that if in the case of the health minister, you think that if immediately he got admitted, he had written just a simple press release announcing the admission, you think people would have gone on to make all those speculations? No. You think that if he had announced this, people would have been pointing out others that I last saw this person with him, track him down. I last saw this person with him, track. No, it wouldn't have happened. Immediately, the persons themselves would have done the needful, gone to the appropriate agencies to report themselves for the necessary action to be taken. So the only reason we speculate and the only reason we keep living in this kind of fear is because we don't have the information. We are not allowed to know what really happened to the person, and so we are scared. We are scared. We cannot receive the person. I like the example you cited, because he himself came back to lament how difficult it was for him for him to interact with people because people got scared and all of that. But all of that goes back to the same point, that people don't know what is happening. They don't know the nature of the virus. They don't know, or they still do not believe that I can not contract the virus simply by doing A, B, C, D. They don't know. So the health minister gets it. He recovers, he's discharged, he goes back to his office. Will his secretary run away? Will the people he's working with in the office run away? No, because the people are informed as to how to interact with him. And so they take the necessary precautions so they can continue to work with him.
Okay. Ebenezer, wrapping up for us, lessons our leaders can take from the Frederick Dra example. I mean, the information ministry invited him in to share his story with the entire country. Yeah. When he survived it. You would think that the rest of our leaders will follow suit and come out and share whatever they're going through with us.
Before people don't get it, and I said it here a while ago, that leadership comes with assets and liabilities. When you take up leadership, you have taken up assets and liabilities. And the asset is what they enjoy. They get all the V8 and all the other benefits. It's beautiful. But when the liability comes to make a certain sacrifice of announcing your status in such a situation, you are running away from it. It means that you are failing. And it's an integrity issue. People need to show integrity. They need to show leadership. And put all of us at ease. I mean, it's as simple as that. I think basically a lot of it is an integrity issue. Look at the CEO of Kolebu Hospital. I'm surprised. You lead such a critical, Ghana's foremost teaching health facility. You have COVID. Even after health minister situation, you've not come out to say anything. And we have to go and fish the information and put it out. I don't think it's disappointing. It's disappointing.
Sisters, how do we, moving forward, approach the news? Because for me, when I heard the statement from Accra Technical University, it came out of a place of love, not fear. Moving forward, how do we handle the news of saying, I'm going to get tested, I've tested positive, I'm experiencing it from a place of love instead of fear? Because fear is what will drive you to hide and not be transparent.
The people will only receive it from that place of love if the news is coming from you, yourself. When you are telling your story, you are able to control it. But if you allow a third person to tell your story, then you lose the story. So the only way we can control all of this, control the fear, handle the stigma, the only way we can do this is for people to proactively declare their status and to say that I have it, I'm being tested, or I have been tested, I'm being treated, I am not dangerous or injurious to you, so don't run away from me.
Thank you very much. Sisters Dong Olo is my colleague in the newsroom, and Ebenezer Afenyi-Dadzi is the head of our business desk at Citi TV and Citi FM. My name is Dziffa Akua Ametam. Stay safe, mask up, and keep watching Citi TV. Enjoy your day.